Your team surveyed more than 300 hospitals about their challenges in responding to the coronavirus crisis and brought to light extremely alarming findings. Being from New York City, I know firsthand the challenges our hospitals have had in responding to the crisis. Your report explained that as the pandemic was escalating, hospitals did not have enough testing or equipment because they lacked access to robust supply chains. As a result, they were forced to compete for crucial supplies like personal protective equipment and test kits. They competed against each other, against states, against the federal government, and even against foreign entities. So my question, Ms. Grimm, is, did your survey find that the federal government was doing enough to help hospitals get what they needed to prepare for this virus?
Thank you for your question, Chairwoman. Our report, looking at a sample of hospitals nationwide, we went to 400 hospitals. We got a response rate of 85% with 323 hospitals responding to us, provided relevant, timely, and useful information to federal, tribal, state, and local decision makers to help target their response efforts. The goal of the work was to help to provide comprehensive information from the front lines in a time of national crisis. I would note that since the report has been released, the department has taken numerous actions to address the issues that we highlighted in our report. We did find shortages of protective equipment, mask gowns, and reported expected shortages of ventilators. And as I said, the department has taken steps to address a lot of the issues raised in our report.
Thank you. In fact, hospitals reported that, quote, government intervention and coordination could help reconcile this problem at the national level to provide equitable distribution of supplies throughout the country, end quote. What specifically did hospitals want the federal government to do to help them access these supplies?
We did, one of the questions that we did ask hospitals is what additional help they needed from the government. And they reported that they would like additional sort of resources related to solvency, that they believed increased costs and lost revenues threatened to disrupt hospital operations. And they also identified problems gaining supplies, the PPE that I had mentioned. And these shortages resulted in some downstream effects because they had to treat patients as though they were presumptive positive, which impacted bed capacity and staff and additional access to masks and gowns and other protective equipment.